Let's now get on to other stories. The Electricity Company of Ghana is facing the risk of severe sanctions for the utilities regulator, PURC, after it failed to comply with directive to produce a load management timetable for the recent erratic power supply. The PURC directed ECG to provide a detailed incident report of power outages for the period of January 1, 2024, among others, but ECG failed to comply with this deadline. This comes in the wake of calls by businesses and power consumers demanding the ECG to provide a load management timetable to enable them plan their operations accordingly. Director of Research and Corporate Affairs at the Public Utilities Regulatory Commission, Dr. Eric Kofi Obuti, says the Commission will determine the next line of action.
How long will that take? Now that you have it, you've told us that you don't have two of them being complied with. Will the process kicking immediately for review and possibly imposition of sanctions? And how long will this take?
Well, we've transmitted whatever it is we have to the commissioners. I cannot give a deadline or time to the commissioners. So if the commissioners come out and tell us that by this time we are doing A, B, C, D, I'm more than willing to come out and communicate that to the public.
Safe to say that you're happy with the remainder of the directives and the ECG's compliance with those?
Well, there's another level of compliance. They're supposed to comply with the rest of the orders by April 2nd. That's next week, Tuesday. So we are waiting to see if maybe some other things in terms of the timetable will be added to those ones which will be brought in by April 2nd. Until then, this is what we have, and this is what we are working with.
We also know that there are still challenges with GRIDCO. I mean, this is a separate question to you as a regulator for the sector, because in the last 48 hours, there have been two notices from the ECG, all referencing a shortfall in supply triggered by GRIDCO challenges. Is the PURC looking into that too?
Once PURC has information to that effect, and we have engineers who work on this all the time, we take it up and we follow it through. But if we don't have any information to that effect, obviously, we only do our routine monitoring exercises.
In the case of ECG, you wrote to them to supply the information because you knew that customers were complaining.
Yes, we knew customers were complaining, and at the same time, we got information from ECG that it is as a result of 630 transformers.
Michael Odumata Nyantechi, who is General Secretary of the Public Utilities Workers Union of the ECG, is of the view that the PURC could have done a better job than laying the blame squarely on the ECG. He spoke to my colleague Evans Mensah.
So what we are saying is that PURC, being the regulator, knows that in the system operator that has the data that will inform the whole public as to whether the quantum of power available will enable ECG to come up with a timetable or not. So to just look at the issue of this 630 transformers and demand a load shedding timetable based on that, we think it's begging the question.
Why do you say so? I mean, if you have 630 transformers that you claim...
630 transformers out of 33,000.
Yes, but...
Any objective analyst will tell you that this number cannot impact the situation that we are experiencing.
So what...
And that is where we think that the PURC would have done this or a better service than by asking the system operators to provide critical data that will help us all understand the state of what is happening.
But Mr. Nyantechi, these 630 transformers, ECG has published where they are, and they are across the country. We still need, from a customer's point of view, I still need a timetable for the specific areas where you have these faulty transformers.
No, but even the point is, these transformers are localized. They cannot affect so many large areas as have been. Like if you take the notice that has been published today about ECG concerning areas that are going to go off, this cannot be attributed to even 100 transformers in the area.
Well, Chairman of Parliament's Mines and Energy Committee, Samuel Atachian, says a load shedding timetable is needed and describes as unfortunate the comments by the Minister of Energy, Matthew Poku-Prempeh, dismissing calls for a timetable. Let's first take a listen to Energy Minister Dr. Matthew Poku-Prempeh.
Energy sector, the current power cuts. Some people are saying that you made mention of this, you use this as a campaign against John Maham, and now we are experiencing a worse situation under President Akufo-Addo. Would it reflect in the 2024 election? Would it be something that people will stand on to vote?
If you are comparing 4 years, MPP administration, energy sector is 300 times better than John Mahama.
But we are still experiencing doom so.
Nobody has said we haven't. I'm just saying it's far much better than John Mahama ever did.
You do admit that there's doom so.
That is the word you used. I have never used that word. I've promised you that we are going to work on it. And it's not a work that is a single event. It's a process. And we'll continue to work on it for the energy sector to become better.
Have you heard of calls for a timetable?
Ask those who want it to bring it.
They should bring the timetable.
If there is, I haven't seen any timetable. So when
people are calling for it.
Say bring a timetable. What do you mean? The ECG says that there's no timetable coming. Why do you want to bring a timetable? What purpose? Why would somebody get up and wish evil or bad for the country?
We can now listen to Chairman of the Mines and Energy Committee, Atachian, on this.
It's very unfortunate that we need to be harassed by, if you like, matters that we've not interrogated. But that's how I see it. And I agree with Rankin that there was necessity for ECG and the rest of them to come before the committee for us to interrogate and tell to everybody where is the problem. Because whatever you say, which is going to solve the problem, what we need to do is that what you have to do, if we are responsible, you need to do it. And then we get out of this mess. But what we had, and I'm very, very honest with some matters, that when we wanted ECG and the rest of them to congregate so we interrogate the matter, we had an intervention from the minister that is out of the jurisdiction. But in such a very important interrogation, he wants to be seated. That's how come we never got around to interrogate the matter.
Meanwhile, the Ghana Medical Association is calling for immediate action to address the power challenges in our public health facilities. This has come at a time where the minority in Parliament is demanding for an immediate exemption of health facilities from the current unannounced and unscheduled electricity load shedding exercise, calling for the audit to ascertain the reliability and capability of alternative power supply. Also, on the back of this is a reported incident on social media that sought to link the death of a baby to a power outage at the Tema General Hospital. Speaking with my colleague Evans Mensah, the General Secretary of the Ghana Medical Association, Richard Salome, expressed concern about the devastating effects of the power outages and the need for a load management timetable to help the health facilities plan.
At the health facility, power is required for many things in the health facility. Equipment need power, and critical equipment, for example, ventilators, even laboratory equipment, require power to function. Beyond this, there is also the drive towards using digital platforms to provide patient management services, scheduling, and then setting of claims, etc. And so across the country, in most of the hospitals, the government has rolled out what we call the LIMS, which is an electronic management system. And so power outages disrupt all these processes because, for example, patients need to be verified. Those with NHIS and other private insurances need to be verified on the system before they start their journey through the hospital. When these systems are off, it disrupts this because they cannot be verified, or it takes much, much longer to get this done for them to begin to procure services within the facility. Beyond this are those patients who may be on the theater table, who may be undergoing dialysis, who may be undergoing various forms of treatment that require power to power machines and equipment that serve these patients. And so it is very important that we put the issue into context. It's not about when only somebody dies.
Let's take a break on journeys. Let's go be back with business.